Good evening, this is Dr. Thomas Klein coming to you yet again from Raleigh, North Carolina, bringing you information that we are discovering at the National Pain Council and at JATH, J-A-T-H, Educational Consortium. We have a team of researchers, nurses, doctors, nurse practitioners, writers, editors, and we've been struggling for the past 2 years to come up with the truth. We're working on the truth. It's taking a long time, and we're going to be slowly producing papers to bring the truth forward a little piece at a time. So today's little piece is called doctor shopping. What doctor shopping is a patient who goes from doctor to doctor trying to get extra pain prescriptions. This originated in Florida, the great opioid criminal activity down there of the two twin brothers. What they did is they took people, hired people on the street, paid them money, they drove them around in vans, and they go to Dr. X with some fake x-rays and get a prescription. Then they get back in the van and go down the street to Dr. Y, same thing, and they would just go all day long. Sometimes they go to 8 or 9 doctors, and then they would go to the pharmacy, and they would go to different pharmacies, and they would fill the prescriptions. 200 oxycodone, which is not a huge amount for somebody that needs it every 4 hours. Remember, this is a drug you got to take every 4 hours, thus the high numbers. So then they would pick up $3,000–$4,000 per bottle, selling it to people from out of state. These are the vans and the trucks that you read about. That's what doctor shopping is. It was a criminal activity, and they were shut down in 2011, but it lingers. It lingers because people aren't smart enough to say, wait a minute, this doesn't really have anything to do with people now. So I asked a person in the government here at North Carolina who's in the monitoring business, that how many doctor shoppers, that is somebody going to more than one doctor, did the state pick up on their PDMP, which is the computer that keeps track of all the opioid pain medicines? And the answer was 4. Then there's a study that shows 2/3 of the doctor shoppers are really pain patients who are not being treated properly, so they go to more than one doctor. It is not illegal to go to more than one doctor if they both know what's going on. So you see, the criminals that want to get prescriptions, they will go to different doctors, and not the doctors don't know. This is 4 people per year. This is what doctor shopping is. And you see, this is a crusade flag. Everybody's, oh, doctor shopping, that's why we need these intrusive computer programs that the government uses to monitor every single person who takes pain medicines and every single doctor that prescribes pain medicines. So then they sit around their little computer modules, and they come up with averages for doctors. So then they find that there's some doctors that are prescribing more than the average. What's the average? And a family practitioner might give opiates to 5 or 6 people a week. A person with a pain practice, like the one I had, might have all pain prescriptions and show up on the computer. So that's how the federal drug police and the government are monitoring doctors and patients with this prescription drug monitoring program, PDMP, that was developed at the Heller School at Brandeis University in Boston. And the grant was submitted by Andrew Kolodny and his colleague, Dr. Peter Kreiner. So whenever we talk about physicians, the way we evaluate them is to look up their previous published papers, and we grant them a score. We have a little system at the National Pain Council from 1 to 10 10 being the worst bias against opiates, and 1 being pro-opiates. Both Dr. Kreiner and Dr. Kolodny had scores of 10, which means that all of their papers that they have written are anti-opiophobic. So if you're accused of doctor shopping, you have to realize that's a criminal activity, because presumably the doctor shopper is getting these extra prescriptions and then selling them. So if anybody accuses you of that, you tell them that you have just been accused of breaking a federal law. Are they sure they wish to proceed with that accusation? Hold their feet to the fire. Do not allow people to name call. I mean, I could run around and call the person down at the McDonald's a murderer. And if I did, I would be accusing somebody of a crime, and that's not proper to do. And it might even be against the law. It's certainly against civil law, because you are trying to ruin somebody's reputation. So do not allow people to claim you are a doctor shopper. Hold their feet to the fire. Good night.